Hi, good evening, and welcome back. Tonight, we have our guest speaker. Her name is Jeanne Marron, and she's a doctor and clinical specialist over at Bergen Mental Health Care. And she is back to talk to us about mental health and wellness awareness, especially in teens and young adults. So thank you again. We are going to be recording tonight's session. If you have any questions, we will email you a recording as well as Dr. Marron's email address if you'd like to reach out to her directly. But without further ado, I introduce Jeanne Marron. Go right ahead, Jeanne. Thank you.
Actually, it's Jeanne.
Jeanne. I'm sorry, Jeanne.
That's okay. It's an odd spelling, so thank you. Thanks for having me. I'm going to my screen shared here, right? Okay, so yeah, I'm Jeanne Marron. I'm from Bergen Mental Health Care, as Justin mentioned, and we have offices in Ramsey and Ridgewood, New Jersey. You can check out our website is up there, and my email is up there for follow-up questions as well. By matter of background, in terms of my speaking on mental health issues, I have a doctorate in clinical psychology and a postdoctorate degree in neuropsychology. And that is kind of where you look more closely at the brain and the nervous systems and its relationship to behavior and emotions and perceptions and all of those types of things. So that's my background. I then have advanced training in diagnostics, in trauma and stress-related disorders, in developmental issues, and a number of other areas. A little older, so I have a lot of different expertise kind of under my belt at this point. But tonight I'm going to be talking about kind of an overview of mental health, defining it, what is it, and how do we tell if something is a mental illness versus maybe just a challenge in our mental health at the moment versus a crisis? Because that's really important to be able to kind of pull those out. And hopefully you're going to realize that there's so many types of mental illnesses, just like there's so many types of medical illnesses that, some of them are brief and mild, and some of them can be more significant and more chronic in nature, and that there's a wide range within the illness and within how they affect people. We'll talk about signs and symptoms, how we recognize what's going on in terms of a mental illness. Talk a little bit about the role of development. Again, I'm going to bring you kind of back to the brain that, I love to talk about so much. And we'll talk about some factors that can impact mental wellness in today's teens and young adults, the role of stigma. We're going to talk about a couple of, I'm going to identify some groups of mental illnesses or disorders for you and give you some examples of the types that fall in those categories. But then I'm going to hone in on a couple that are kind of common in the teen and young adult years, especially anxiety and depression. But I also am going to address some serious topics like self-injurious behavior and suicide in terms of risk and protective factors that aren't mental illnesses in and of themselves, but can sometimes accompany either a mental illness or just a mental health challenge or a mental health crisis. So we're going to look at those as well. And then I'm going to kind of bring us back to where we were last month, talking about what are some everyday activities that can help everyone's mental health, and then a little bit more information on what to do if you need more. So let's get started. What is mental health? Well, there's different definitions. This is one basic definition that defines mental health as including our emotional, our psychological, and our social well-being. It affects how we think, how we feel, how we act. It also affects how we handle stress, maybe interact with others, and even our decision-making and choices. It can be very complex, nuanced, and it's something that I think it's a fascinating field because we still have much to learn about mental health. Another kind of more advanced definition is this one, where mental health is defined as a dynamic state, a kind of moving state of internal, equilibrium that reaches equilibrium despite all the dynamic components in it. And it enables you or us individuals to basically use our abilities in some kind of harmony that's inclusive of universal values of society. So it's our basic cognitive and social skills, our ability to recognize and express our own emotions, to empathize with others, to be flexible, to cope, and to to deal with and come out of adverse life events, like perhaps someone you're feeling during this pandemic, to function in social roles, to have harmonious relationship between the body and mind. And I'm going to talk a little bit more about that. And to, kind of represent components of mental health, which contribute to varying degrees to your state of equilibrium. So it's a little bit broader there, but I like to kind of break that down for people. In terms of mental health and what is a mental illness, the things that we look at in our field are, what are the person's perceptual experiences? How do they interpret the sensations, what they're seeing, what they're hearing? Are they having, perceptions when there isn't anything being said or to see? Are the perceptions accurate and in touch with reality in the world? Their cognitions, and that's everything about how we think, their ability to focus, to sustain attention, to comprehend things, their memory, their beliefs, their problem solving, and all these executive functions that our frontal lobe helps us to do that I'll touch on a little bit. And then another area that mental health involves very much so is, and you probably think of this one pretty readily, is your emotions, your moods, your feelings. And of course, your behaviors. What we do is part of our mental health and mental illness, our actions that we take based on these things above it. And then our motivation, our internal desire to do or not do certain things. And also our sense of identity and belongingness and co-belongingness. So our sense of ourselves, our sense of others in the world, and then our sense of the world itself. All of that is part of our mental health and our mental illness. And those are some of the things we look at. Are these things affected by whatever's going on in the individual's life right now? Now, what are some of the factors, though, that might lead to having great mental health or maybe being more susceptible to a certain mental illness? There are lots of different factors. So biologically, there's factors that you really can't control, your genetics, some of your neurobiology, like your metabolism, developmental variations that some individuals experience. You may have a physical illness, let's say spike a high fever or have a seizure that could affect your mental health and or even give rise to a mental illness going forward. Toxin exposures, things like lead exposures in young children can really be an issue. And then even injuries, injuries to your head, especially can affect your mental health and the possibilities of mental illness. There's other kinds of things too that aren't just within your body that can play a role in either increasing your chances of very strong mental health or increasing your chances perhaps of a mental illness. And those are your experiences that you have in the world while you're living here. So your teens and young adults. So for all the years that you've been here, were there any injurious traumas? I'm talking more, some of these could be physical traumas, but they also could be interpersonal traumas, fear-inducing kind of experiences, abuse, chronic stress, what is this pandemic creating for a lot of people right now? Chronic stress. We talked about that in January. The ACEs, which is adverse childhood experience. We've seen that if an individual experiences too many adverse childhood experiences which involve significant things like abuse, loss of parent, things like that. If they have too many of those in their life before the age of 18, that they're more likely to have some pretty serious medical issues later on as adults, as well as mental health issues later on as adults. But we also know that experience can provide protective factors as well as risk factors. So being connected to others, having good relationships, things that I talked about in January, all help build up our protective factors to help decrease the risk factors for mental illness. And before we go on into talking about the mental illnesses, everyone that I talk about, be aware that recovery is always a part of it. Recovery can happen, and it does happen. It often happens at a pretty significant degree. There are lots of treatments and methods to enhance our mental health in general, and also treatments and methods to decrease the effects of a mental illness in our lives as we go along in life. So there's a lot that recovery can do. There's many things people can do to enhance their own mental well-being as well. And a lot of those things I went over last month in January. But about recovery, I also want to mention that, you know, people, when they do experience a significant mental illness, recovery can look very different for each person. So recovery for some people may be that they get back to their baseline, kind of where were they before they had this mental illness. So think of it, you know, if you had a medical condition that you had treated, and then you're back to your previous medical status, because mental illnesses are medical illnesses too. So it would be something where you have the mental illness, you get treatment, and you know, something happens to change it, and you go back to your baseline, to how you were before. For some recovery, for some of the more serious and often chronic type mental illnesses, recovery may be reaching the highest level of functioning despite having that mental illness and those symptoms still impacting, that we're minimizing the amount that they impact, but they're still going to have some kind of impact here and there. So think about the individual who maybe as a teen or young adult gets diagnosed with diabetes, but then gets a really good treatment regimen. It's going to be a chronic condition. They have to constantly monitor and do things to take care of themselves, right? Change their behaviors, things like that. So they may not reach the level of being diabetes free, but they can function, you know, very well. Despite having some symptoms of the diabetes still affect them here and there. Same thing with mental illness. Some people may not get back to before having the mental illness, but they can actually reach a point where they're functioning, you know, despite some impact of those symptoms. For others, there might be, you know, that peak for them in recovery might be managing more serious symptoms, and it might be a little more challenging. And that's where we need to do better in coming up with treatment modalities for them. But then a lot of people may experience something in terms of a mental health challenge, a mental health crisis, or even a mental illness, where they either engage in self-help or get professional help, or a combination, hopefully, of both, if it is a mental illness or a crisis. And they learn things. They learn skills and behaviors, and they may actually affect how they think, you know, in terms of how they understand what's going on with them in the mental illness and or just in their lives. And so that afterwards they start to continue to apply these things that they learned, these skills that they developed. And so they actually afterwards are healthier than they were before. So imagine the analogy of a young person, maybe in their 30s, having a cardiac event, a serious cardiac event. And after that, you know, they learn to take care of their cardiovascular system in terms of their health habits, and they actually become a healthier person after it. Whereas the same thing can happen with mental illness. All the things that we talked about in January are things that can help anybody, whether you have a mental illness or not. They help strengthen your mental health. So applying those plus other things you might use or learn of during the process of treatment makes your recovery where you're going to actually have post-recovery growth. You're going to have grown through the experience. So there's a whole variety of what and range of what recovery like entails. So mental health, bottom line is, it's medical health. It's just health. It's a part of our health. Like cardiac health has to do with the heart. You know, mental health has to do with the brain and the nervous system. And, you know, it's just a part of our basic health. It's one that we used to separate out as something distinct, and we need to stop doing that and really come to understand it as something we need to take just as good care of as we do other aspects of our health. I apologize, I was supposed to take that slide out because I kind of speak to it in different places. But mental health, everyone can experience changes in their health, including their mental health from time to time. But when symptoms occur, how do we know it's a mental illness and not just a little, you know, moment of challenge? Well, the answer to that is the way in which psychologists and psychiatrists and others diagnose mental illnesses is they look at symptom lists, and they also look at does this create a lot of stress or distress for the person? Is it impacting their life significantly? So if it's causing distress or it's interfering with one's ability to function in some major area of their life, then that's kind of the threshold that we say, okay, this is a mental illness. That's also kind of the threshold that you should be thinking about in terms of going for a consultation or an assessment and possibly even treatment. We like to kind of nickname number 2 up there, that interfering with your ability to function, as your live, love, laugh. Okay, so your live is everything you kind of have to do, all the expectations and responsibilities you have in your life. So if you're a young adult working full time, it's your occupation, it's your employment, but perhaps you're a teen still in the later years of high school, getting ready to transition to college, then the high school courses and the college, pursuit. And when you get to college, that's your live, the responsibilities related to your studies, or the responsibilities related to your job. And then other responsibilities too, like responsibilities of daily living. Some young adults, and older teens actually have a caretaking role for younger siblings, or maybe they're already parents themselves. So they have a lot of responsibilities to their own family unit. So that's the first L, live. Love is not romantic love. By love, they mean every kind of social relationship. So has the symptoms impacted the individual's ability to have, successful relationships? Are they effective and successful in their social relationships, from people having close friendships to being able to be with others and enjoy kind of the connection of groups or teams or activities and affiliations, things like that, to being able to get along with coworkers or with bosses or with professors or their teachers. So being able to really successfully navigate all the different types of relationships that adulthood is going to entail, and young adults and teens are already navigating. And then the last L is, does it affect the rest of your life, your passions, your interests, your talents, your skills that you already have, the activities and interests you do when you don't have to deal with just your responsibilities? Is it affecting those things? Because some people, you'll see when they are experiencing certain mental illnesses or challenges or crises, they start to back away from some of those things that used to give them joy. And that has a reciprocal effect, because then they're not getting kind of the good brain chemistry hits from that activity, and they back away from it more. And so that they're kind of reinforcing some of the symptoms of what's going on, which, we need to be aware of. So I keep saying these terms, symptoms. Sometimes people use signs, and I often get asked, like, what's the difference? So I decided to kind of like make sure I always address this when I talk about mental health. So a sign is something that's observable. It is a part of our mental health, and it is a part of mental illness signs. It's something, though, that someone can see from the outside that's observable. So you could be teary, right? But do I know what that teariness means? That teariness for some could be they're overwhelmed and anxious. For others, it could be they're grieving at that moment. For someone else, it could be they're extremely happy. They found out they just won the lottery. It's unlikely, but it could happen. So signs are only observable. They're things that maybe you will notice. You might be able to notice, like changes in a family member or a friend or a peer, and we may not know what the meaning of the change is, but signs are things that we can see. Symptoms, on the other hand, are a combination of signs and other things that sometimes we have to dig a little to find out what is the meaning of that sign, or maybe there was no sign. We have to ask about the person's thoughts, because we can't see people's thoughts. We have to ask about their feelings, because we can't always see their feelings. We have to ask about all those things that I listed earlier that make up our mental health, our perceptions, our cognitions, our emotions, our behavior, our motivation, and our sense of ourselves and others in the world. We have to ask about that. So a lot of it is really by report of the individual experiencing things, and maybe by people that know them well, if there's been some changes or things like that in their life. And it really is, kind of going through and figuring out basically good diagnosticians when it comes to mental illness rule everything out before they rule something in. So signs and symptoms focus on, different things. Is there a delay? And this would go more for some of the neurologically involved things that happen in individuals and may start early in life, so more developmental kind of experiences. But is there a delay or a variation or a change in those things that, again, that I talked about earlier, the perceptual experience, the cognitions, the emotions, the behavior, the motivation, the sense of the selves, others, or world. So here's a sampling of just like the huge overarching categories. And then under these categories in actually a very big book we have, it's called the DSM-5, kind of has, you see it's really big, has all the diagnoses in it, from things that are developmental in nature to things that involve aging, to substance use, to more, to the types of mental illnesses you might be more familiar with, like anxiety and depression. So everything's in there, and they get put into these kind of overarching categories. And I just gave you a sampling of the categories: neurodevelopmental disorders, schizophrenia, depression, bipolar, anxiety, trauma and stress-induced disorders, and substance-related and addictive disorders. Now the bold ones, the depression, anxiety, trauma, and substance-related, we're gonna probably touch on a little bit more this evening because they're kind of more relevant to this age group. Speaking to that, let's just look at some numbers in the adults. So in our general adult population, which you're all moving into or already there, 1.1% of adults in the US live with schizophrenia. So that particular mental illness is a low incident mental illness. But interestingly, that is one whose symptoms typically start to appear during adolescence, late adolescence, and early adult years. 2.6% of adults in the US live with bipolar disorder. It's a mood disorder where there's not just depression, there's also this expansive, overly energized kind of mood disruption. And there's a lot of subtypes, but also not a huge incidence, still at 2.6. We do have people that begin to have bipolar disorder as young as teens and young adults, but the age of onset is usually a little bit older, like in the 30s for most cases of it. 6.9% of adults in the US, that's 16 million, had at least one major depressive episode in the past year, and over 18% experience anxiety disorders or a stress-related injury like induced traumatic disorder, such as post-traumatic stress disorder. So those are the more common ones, and the ones that also tend to start early in life, anxiety and depression symptoms. Also, it's notable that among the over 20 million adults in the US that experience a substance use disorder, over half of them had a co-occurring mental illness. So there's a lot of talk you'll hear in the media and things about self-medicating, that perhaps the substance use disorder was in part driven by an effort to kind of affect the symptoms of the mental illness they were experiencing, whether it be depression or anxiety, or maybe they did have a serious mental illness like schizophrenia and were hearing voices and they were trying to stop the voices. There's lots of possibilities. But let's focus on the teen and young adult mental health a little bit more. So I'm going to give you a few more statistics. For serious mental health disorders, the kinds like that involve psychoses and are very hard sometimes in some people to get to kind of completely go away, those severe mental health disorders affect about 13% of children aged 8 to 15. And then by the time you're 13 to 18, which, as older teens and maybe very young adults, some of you are there at the 18 point, 1 in 5 experience a severe mental disorder by that point in their, at some point in their life is going to. So whether they didn't already start to have symptoms, they're likely to have a severe mental health disorder at some point in their life. And about 50% of those very chronic, more severe mental illnesses that do last throughout the individual's lifetime, about 50% of those start by age 14 and about 75% by age 24. So keep in mind those ages that I'm talking about, that teen and young adult years. It's really relevant to mental health in many, many ways. And sadly, we misinterpret a lot of the mental health behaviors that occur as, crimes or, errors or failures on the individual part. And as a result, about 70% of those placed in our juvenile justice system have at least one mental health condition. And at least 20% live with one of these more serious mental illnesses. So we've really kind of missed the mark on a lot of placement in the justice system versus the mental health system. So what about before you got, some of you might still be in this age range, but what about right before this age range? 12.63% of youth aged 12 to 17 had at least one major depressive episode in the past year. And 61.5 of those did not get treatment. The majority of individuals experiencing some serious things like a major depressive episode didn't get treatment. And 4.6 of youth aged 12 to 17 reported a substance use disorder. And we know that's probably pretty much underreported. Keep in mind as we talk today that trauma has a significant impact on an individual's life, on school, on work, and on social functioning. And we often don't talk enough about trauma and the kind of post-trauma mental illnesses that the person is left behind with. It's estimated that 24 million plus individuals are experiencing some kind of mental illness right now and are not in any form of treatment. And that number's gone up because people have had more challenges going to treatment given the pandemic. A few serious statistics about youth suicide. In 2017, suicide was reported to be the 10th leading cause of death for all ages. However, what was shocking in the studies, and this has been going on since at least 2014, the age groups, for the age groups 10 to 14, 15 to 24, so that's your late teens and your young adults, and more of your young adults into even middle, moving into full, kind of early adulthood, the 24 to 35-year-olds, all three of those groups, turned out that suicide was the second leading cause of death for all three age groups. And the only thing that beat it out in each of those groups was unintentional injury. So if you think about it too, some of the overdoses that individuals die from in those age groups, some of the risk-taking behaviors, kinds of accidents, they actually end up in that unintentional injury category and may very much have also been a suicide, but there was no definitive way to prove that. And these stats, again, are from the National Institute of Mental Health and National Institute of Health, in case you're interested. So keep talking about this, this point of 14 to 24, or the teen and the young adult years. And that's because mental illness and mental health are really, really important during the teen and young adult years, because the brain is going through a huge phase of development. Only toddlership does the brain really grow in certain ways and mature in certain ways as it does in adolescence. So, this is our brain. This is the brain stem. This is your spinal cord going up into your brain to the brain stem. And there's considered three regions. There's the lower region. I talked about that last time in January because it's involved with the fight, flight, freeze modality of stress and anxiety, and then the second layer has the limbic system and more to do with memory and emotion processing and social processing. And then we have these four lobes on top of the brain, right under our skull. And there are higher cortical regions. They're kind of what defines us as humans. They allow us to do all kinds of sophisticated things, from, sing to kicking a ball, to learning language, to solving a math problem, to, being good at chemistry, to being a good actor, whatever it is that your talents are, that part of your brain, it's using these higher regions that really allow us to do all of that. And the area that's most important, this is all predominantly developed, but the last area of the brain to develop in the higher cortical regions is right behind our forehead, and it's called the frontal lobe, prefrontal cortex. You'll hear different names for it, but basically it's our executive functioning. It's like the boss of the rest of our brain, and it's the most sophisticated area. It starts to help you go from like thinking concretely and only black and white to, oh, there's a lot of gray, there's a lot of angles in this, to being able to see things from a lot of different perspectives, understand there's a lot of different angles. It helps your humor go from like that slapstick, immature kind of humor to like a higher level of sophisticated wit in your humor. It helps to problem solve, to cope, to anticipate consequences, to think reflectively, to think about your thinking. It allows you to do all those kinds of things, to help control your impulses, all of that. And that is what is exploding in terms of development for the teen and young years. And in males, that part of your brain, as far as we know with the best research right now, doesn't end until about age 30. And in females until late 20s, right? You know, very close to that point. And what's happening is, you know, there's not just growth. It's not that the brain mass is growing by, you know, early, like late tweenhood, early teens, depending if you're female or male. The physical growth of the brain is done. It's not that. It's that you have these neurons inside your brain, and that's how your brain communicates. It sends information down these neuronal pathways to tell your arm to raise or tell your arm not to raise, to help you hit that high note or whatever you're doing. Your brain is controlling all that. And these neurons here, the pathways are developing and growing. And so their interconnectedness is part of what the maturation and growth is that's going on. And also there's this issue here where the neurons, none of them actually touch to talk to each other. They're all kind of interwoven around each other, like this mass of strands. And what they do is they release chemicals from one to the other. And that chemical tells this neuron whether to fire so that you raise your hand, or whether not to fire so your hand stays down. So your chemicals, the chemical composition in your brain is also maturing during this time. Sometimes there can be a problem with that. And that's why sometimes medications help with mental illnesses, because sometimes not enough chemical gets released into that gap right there. Or sometimes too much gets released, or sometimes there's a problem with the neuron it's talking to. Maybe its receptors are closed, or there's not enough that have matured yet to take those chemicals in. So there's a lot of things that can happen at that end. And then on top of it, this part, the myelin, which helps protect the neurons in your brains, and you have billions, right? It helps to protect it, but it also helps it to fire faster. And during your teen and young adult years, you're getting a lot of myelin building up on your neurons. So your brain is literally becoming incredibly more efficient during this stage of your life. And in addition, one last other thing is going on. You're getting pruned. Some of those pathways you don't need are kind of getting pruned away, just like you prune a bush, you know, so it grows back better. That's kind of happening during this whole process in your brain. So there's a lot of great, fascinating things going on, but all those things are opportunities for an illness to have an effect, for something to go wrong. So these are the things that are involved when there is a mental illness occurring. So what are these mental health disorders? Well, you know, in terms of, you know, ones that maybe you would have had from very early in your life, since youth, those are the neurodevelopmental disorders. So some are things like intellectual disability. Some you might be more familiar with would be like the autism spectrum disorder, or ADHD or ADD you might have heard, or like a specific learning disorder, you know, dyslexia, or maybe dyscalculia, some kind of learning disorder. Other neurodevelopmental disorders, again, they stem back to your youth. And they affect, remember I said the things can be a problem with delays or with like variations or changes in your mental health. These are things that involve delays in the brain's development. So language disorder, speech sound disorder. We just had a president who was elected who actually had a stuttering, diagnosis. So, a lot of these things people can, like I talked about earlier, can not only learn to live with, even if they're chronic, but can kind of achieve above what maybe they did when they first were diagnosed with it. There's motor disorders, and some that are kind of more frequent that often don't get discussed. Look at this, 3 to 8 per 1,000 individuals have Tourette's disorder. Tourette's disorder is a motor, it's in our motor system, motor meaning movement, right? It's a motor disorder, and it's actually, to have Tourette's, you have to have 2 kinds of tics, and that is, a tic is something you can't help but doing. It happens and you can't control it. It's like your movement or the thing that's happening is involuntary when it should be under voluntary. So if I go like this with my arm, or like that, usually maybe something like that, or grimace with like the side of my mouth, and I can't help it and I can't stop it and I can't predict when it's going to happen, that's a tic. And if I have one of those, a motor tic, like a movement one, and I also have a verbal one, so it might be usually, the TV shows like to show you Tourette's where their person's swearing and saying all these very interesting things, and that's part of the Tourette's. Not necessarily very rarely the case, actually. Usually it's not in words. It could be something like, or maybe a chirping sound, different sounds, things like that. So this is one you should be aware of, because this is something that you may encounter in yourselves or your friends. And then other mental health disorders more focused in either the teens or young adult years, or the later adult years. Anxiety disorders. Anxiety disorders often start in childhood, but if they're not addressed in childhood, they can result in depression in the teen years. Same thing, if they're experienced in the teen years, not resolved, they can end up resulting in depression in the young adult and adult years. So that's why we kind of have the anxiety disorder, and then the mood disorders, which is depression, bipolar, and other things. There's obsessive compulsive and related disorders. There's the trauma and stress related disorders that I spoke about. Very common for teens and young adults to have some form of eating disorder. Also very common to have a sleep-wake disorder, which can really impact your functioning across all areas, and often hangs with other of these things. People with anxiety disorders or a mood disorder, or trauma and stress related disorder, often they also have a sleep-wake disorder that kind of goes with it. Gender dysphoria is when an individual is not comfortable in having to remain in the world perceiving them as being the gender that they don't feel they are, that they're being assigned, they were assigned a gender at birth and they don't feel that. Many individuals, when this occurs, and gender identity starts very, very young. This is one that goes back to very young children. If they're, by the time they're a teen or they're a young adult, and if they haven't been able to express who they really are in their identity, then that can create tension, anxiety, and depression kind of symptoms in the person. And that's when they would have gender dysphoria. And then the other one up here, I have some of the other big categories again, but substance related disorders are very common in the teen and the young adult years. And also are these, where's my cursor? Here we go. This last one, we have just things that are just called like adjustment disorders. So these are things where the person is affected by stress or a life event or an adjustment they have to make, or a loss in their lives. And a lot of people right now, this is kind of the type of mental health or mental illness they're struggling with, especially with the pandemic. So what about anxiety? Well, anxiety basically is characterized by a lot of tension, by, kind of worrying, feeling the tension in their body. It affects the person when they're at school or when they're working, in their home life and their relationships. Some of it can be specific to one area where people might not be as anxious in another component of their life. There's lots of different types. And what's interesting is anxiety, you can have an anxiety disorder itself, but also it's kind of hard to pull out sometimes. Anxiety is a major symptom. Remember, I went back to symptoms. Anxiety is a major symptom of many of the other mental illnesses that we deal with. So things like mood disorders or trauma and stress related disorders, they both include anxiety as well. And again, any untreated or poorly treated anxiety in childhood can lead to depression in teens and adults, and the same for anxiety in teens can lead to depression in young adulthood and later adulthood. So these are the different types of anxiety disorders. Like usually the separation anxiety and selective mutism, these are the kinds of things that would have been experienced as a young child most often, not always, but most often. But by the teen years and young adult years, you could develop a specific phobia. This is where you have a lot of anxiety in reaction to a specific thing. It could be an animal, maybe spiders, it could be heights, but it's going to be something that's very, very specific. On the other hand, social anxiety is kind of like where your fear and your anxiety is all focused on having to perform in front of others, having to interact with people, speak to them. So it's kind of, sometimes people that have these early on may end up having this later on. Then there's panic disorder. And that is kind of, some people with any of these anxiety disorders can also have panic disorder, where they go through these phases where suddenly their just anxiety gets so intense so quickly that it almost feels overwhelming physically, let alone emotionally and mentally. And they kind of can't do anything in that moment. Agoraphobia is the fear of open spaces. It's a specific one like the specific phobias, but it happens enough, it gets its own kind of grouping. Basically, because you're afraid of those open spaces, you tend to start to kind of make your life smaller and stay in your comfortable place, which means you often stay at home. And that's why a lot of times people mistakenly think that agoraphobia is the fear of leaving the house. It's not necessarily that, but it can get to that point. Generalized anxiety is much more common in children, teens, and young adults. It is basically that it's not to a specific thing. It's not just social, but you have a high baseline of anxiety across scenarios for the most part. You may still have like your comfort zone, but you have a higher level of anxiety than others might in many situations. And it causes you distress, and it interferes with your live, love, laugh that we discussed. Substance or medication-induced anxiety disorders, and some can happen because of medical reasons. But here's a whole slide just of all the other disorders that anxiety can like play a role in. And I just gave some examples. So like post-traumatic stress, acute stress, adjustment disorders, that would be like people really suffering from stress due to pandemic. The pandemic might have an adjustment disorder right now. But also like hoarding behavior, or maybe hair pulling or picking at your skin. So keep in mind, we talked about this in January, that when any stress is significant or chronic or toxic, it acts much like anxiety does, which we just spoke about. All right, so what about depression? Well, depression, so bear with me as I talk about depression. Depression is a mood disorder. I am going to stop my share to switch to show you something else. And hopefully I can do this. Here we go. Hopefully you're seeing this. This is a little PSA I want you to watch. And here we go. Everybody seeing this?
I'm sad.
Oops.
I feel sad. I'm stressed.
Okay. Oh, sorry, I have to. Sorry, give me a minute, I'm coming back. Get back to my slides. So that PSA was about, depression in teens and young adults. And, it's basically, everybody hopefully can see my slides again. It basically kind of showed some of the challenges that, there's all different possible experiences they showed. And then they also showed what I thought was a really impressive component of how sometimes, teens and young adults and many people don't share with people they're close to what they're really experiencing, what's really going on inside of them. You can see that she was asked how she was, and at first she said she thinks she's depressed, and then she takes that off and she says, I'm fine. And I think too many of us try to do that rather than to reach out and actually connect with people when we're struggling. So another study showed that in 2017, 31.5, that's almost a third, that's almost 1 out of 3 high school students experience periods of persistent feelings of sadness or hopelessness. And they meant like the level that was at the kind that we would ask to screen out for major depression. So it was almost every day for at least 2 weeks or more. And they stopped engaging in usual activities, et cetera, because of it during that past year. So that's a really high rate. And think of this, our data is a little in a lag right now because of the pandemic, but it always is on some of these kinds of major health studies in different age groups. But this was pre-pandemic. So a lot of people have been affected by the stress, and that number could be higher when we look at 2020. But what is depression in teens and young adults? It's sometimes similar to what it's like in other adults, older adults. It involves, and you're not going to have all of these. Your friend that may be having depression is not going to have all of these. You have to have a certain amount of them. I'm not going to go into all those details, but basically usually some change in your mood or, how you feel definitely happens. And then you see changes in kind of your basic life functions. So your eating behaviors, your sleeping, your energy level. We saw that all expressed in that PSA that I showed, the little film. There's a decreased interest in things or responses to things you used to enjoy. And this isn't like where it's developmentally appropriate. Like, you know what, I'm kind of done with, that particular like sport or activity or instrument. I'm going to go and take up this particular activity, this new activity that I think I'm going to enjoy more. I'm going to put away the guitar and I'm going to start painting because I really think I'm meant to paint. That's different. That's expected as you're aging into adulthood to kind of put away some of your interests and form new ones. But if you put them away because you're no longer have the interest in them and you don't take on new interests, that could be a concern. And along with that kind of goes this reduced desire to participate in general. And you see a decrease in performance, whether it be at school, in a sport, at work, whatever it is that you're doing. And then of course, sometimes the mood change can, and doesn't always, but can involve an increase in kind of really expressing sadness and tears and things like that. But it doesn't always involve seeming down. The individual may just seem quieter or flatter, or maybe they're putting on a good act and they're trying and they're kind of laughing like when things aren't so funny, because they're trying so hard not to show their depression. But, you know, inside there tends to be an increase in negativity towards their self. They may have, you may see a decrease in the self-esteem or a sense of guilt or shame develop, or maybe just a persistent sense of boredom or just no energy. Hopelessness or helplessness, that's one of the bigger things to kind of be aware of, because that means that, you know, the depression is pretty significant. Starting to have problems in relationships, maybe being oversensitive to jokes, to teasing, to feedback, may interpret things as rejection or failure that really weren't meant to be that way. And you also see, remember I said they may not always seem sad or down. Instead, you may see actually irritability or anger. Or like that flatness I talked about earlier. And you also may see complaints of physical illnesses, because sometimes people actually do feel incredible discomfort and even pain when they're depressed. Running away ideation or attempts, self-injurious behavior. So self-injurious behavior can come in many forms. The most common is during the teen years, and it is usually involves non-suicidal self-injury behavior, where the individual may hit their head on something or maybe cut themselves or burn themselves. And it's a symptom that, you know, it can happen in many different, you know, mental illnesses or crises or challenges, but it's definitely can happen in depression. And it is something, it's a red flag to kind of, you know, make sure that the individual's been assessed to see what is that's giving rise to that. And then, and self-injurious behavior can sometimes be just risk-taking behaviors. Also, it could be something, you know, I said it's not often most often it's non-suicidal self-injury. So the person's intention is to just do what they're doing, the cut or the burn or the hitting themselves or something. They're not intending to die. However, suicidal ideation does happen in depression. And that, again, is a huge red flag, and that needs immediate assessment by a professional. Now, think about this. About 5% of the childhood population have this serious level of major depression already. And that just starts growing in numbers in teen years, and again in the young teen years, and on and on. Some of the risk factors are if there's a family history for depression, if there's been significant losses or stresses in the person's life, if they already have an attentional or learning issue, behavioral issues, that anxiety disorder I talked about, that piece I keep mentioning, or trauma and abuse in their lives. Those can be challenges. So other things to look out of, another way to kind of just say everything I did before is you might see drastic mood changes, withdrawal, from groups or activities. But if you see self-harm, that's a red flag. The risk-taking behaviors, red flags too. References to any suicidal ideation, even passively in their writing, their art, their conversations, red flag, their social media posts. Self-medication or any other kind of new obsessive approach. Reduced effort or apathy, inappropriate responses, and then those changes physically in sleep, eating, and self-care, those are red flags. So it also can affect their thinking. They might start to think kind of, you know, more negatively about themselves and others in the world. They may become kind of all or nothing thinkers again, even though their brain is really exploding in their ability to think so much more nuanced and complexly, but they kind of get in these ruts, or maybe catastrophic thinking like, oh, I'm never going to be able to do this. Or maybe they think there's only one path to success and they can't quite get on that path. And their attention and concentration is challenged. Problem solving and coping that they could do earlier kind of goes out, you know, of their lives. And they may even complain of sluggish thinking or brain fog and self-blame. And some might end up having like a sense of, well, they have no control or effect on anything, so why bother? And others might actually feel like they are the cause for everything, and that can both be involved. Both ends of that extreme can be involved in depression. And again, that suicidal ideation is a red flag. There's other mood disorders. There's the one that's like starts usually younger but lasts until it has to start by the age 18. That's called disruptive mood dysregulation. This one is really characterized by irritability and agitation and anger and outbursts. Bipolar disorder, again, that's that vacillation between an inflated mood of good, I can stay up all night for 4 nights in a row and accomplish so much of my art or my music. And then, going into a depression phase. I suggest you look up Kevin Hines and the ripple effect. That's why I have this picture here to remind me to mention his film. He, even though for most people, this bipolar disorder starts a little bit in like maybe the 30s, he's an individual who his bipolar disorder started when he was a teen, and he has a whole mental health education program and a film called The Ripple Effect. It's really well done. So he talks about experiencing this serious mental illness as a teen and the impact it had on him. If by any chance someone does have suicidal ideation, the prevention hotline is here. You may hear these kinds of terms about ideation plans or whether there's intent. It doesn't matter if someone expresses the ideation, all of it needs to be taken seriously and addressed. And if you're not comfortable getting them to someone to assess, then get someone who will be comfortable doing that to help you. You might want to consider taking a mental health first aid course. They're available for individuals 18 and above, but there is now a teen program that I think is for juniors and seniors in high school can take it. It's like an 8-hour course, but it introduces you, it kind of talks about the things I'm talking about, but does some more activities and gets you to like learn a model how to help someone if you think they're in a crisis. Basically how to kind of get help and stay with them till the help gets there. Just in terms of some of the stats, again, for that 2017 study, teen males had the highest suicide rate in it from age 15 to 19. And men also had a high rate in the 15 to 24 year range. Over 5,000 died by suicide. That same year, it was 1,225 girls and women from 15 to 24. So men, are dying by suicide more than women are, but it doesn't mean that women aren't attempting it. One of the issues there is that people who die by suicide tend to be people that choose more fatal means, unfortunately, and males tend to do that over females. In the young adults, 20 to 24, who died by suicide, it was at a higher rate than adolescents, but the rates for adolescents showed a steeper increase. So that was worrisome, especially with the teen boys dying by suicide at nearly 18 per 100,000 rate, and females at over 5 per 100,000 rate. The good news is the 2018 data is starting to come out, and it's looking better. It's looking like those numbers are starting to go down, at least in the teens. I haven't seen all the young adult data yet. So I talk about some trends here. I know we're running out of time, but the bottom line is that I want to kind of go down to this item, that at the same time, these studies showed that the death from opioid overdoses rose as well, from 2005 to 2016, and went up doubled during that time, and it went up another whole 10% on top of already doubling just in 2017. And again, we do notice that some of the data in terms of suicide is looking better, that's coming out, and I hope to be able to include that down the road. But what are the protective factors? There's a circle of support for adolescents and young adults and all adults, really, having peers that you can connect with, family, school, community, and lots of teens and young adults are lucky because they have at least one social support or a really full circle of support. But for those adolescents and young adults that have less support, navigating crises can really be more challenging. So even having one support at the right moment can make a difference. And sometimes it's you, your peer, your friend that needs that support, and you're the one that is that one element for them. What can you do preventively? You can create and join groups and cultures in which emotional well-being is valued and good mental health care is encouraged. Do a yoga class or a Qigong class. Learn about mental health information and resources like you are now being here, and consider taking a mental health first aid course. Learn to listen non-judgmentally. Identify for yourselves to take care of your own mental health supports in your life. Practice being open with those supports and connect to valued others in general. Go or send for risk assessments as needed, or go or refer your individuals, your friends to professional services as needed, and be kind and compassionate with yourself. Prioritize your self-care and your well-being. This is your brain and your nervous system and your whole development is at a really critical, amazing state. So nurture it and help it to become as healthy as it can be. If you are struggling or a friend is struggling, here I'm providing slides on the National Suicide Prevention Hotline and some other resources, both web pages and hotlines that are really helpful. This one, the second floor, is run by youth in New Jersey. It's not for crises, but it's for people that are experiencing challenges. And keep in mind, about half the people that actually deal with a serious mental illness never go to treatment, and many that do don't stay in treatment. It takes many 10 plus years to get into good interventions, and that's because of stigma. And stigma interferes with our ability to get research dollars, to understand mental health better, to develop treatments. It interferes with people being willing to say they need help and go for services. There's a lot of things that stigma really plays a role in. So be aware of that. Language matters. Sorry, that's an activity we're not going to have time for. But use first person language. Please start to eliminate mental health terms as slangs or jokes or insults. We do way too much of that. And try to, eliminate the negative slangs associated with mental illness. Oh, they're crazy. There's a lot of really damaging terms that we need to kind of eradicate from our language. And be aware of this, because some of you are probably readers. What's being written about this and in the things you're reading. Learn the correct language and teach others and use the terms and avoid misusing them. You don't have PTSD because you couldn't get your favorite parking spot. People say things like that, or I'm so depressed because of this. That really diminishes what someone's experiencing, who does have those challenges. So please be aware of that. I included this because, it's a song by, probably most of you have heard this song because of your parents and your parents' generation, by Elton John. And this line about, in the cracks along the sidewalk, nothing grows no more. But sometimes things do grow in the cracks. And when it does, and that happens in people, that's called resiliency. So remember, whatever's going on, if it's just a mental health challenge, a mental illness, a crisis, our bodies and brains are designed to go back to baseline. And whatever you're experiencing, anxiety, depression, whatever it could be, distress, trauma, it won't last forever. And we also, if you look back on last month, remember that you can intentionally bring your body and brain back to a calm and present place. And being able to do that, learning strategies to do that, is called resilience. We talked about that last time. So we also talked about kind of these underlying mental wellness basics for all: good nutrition and hydration and regular exercise, stillness, quality sleep, scheduling time to relax and to have fun, using humor, being connected to others safely because of COVID, becoming part of the community again safely, being service to others, and expressing gratitude. Expressing gratitude 3 things a day, every day, actually decreases depression symptoms in people with serious major depression. It also helps to ward off and minimize depression in people who don't have quite that high level of clinical depression. So it's a really simple thing to do, and it's a really effective thing to do for your mental wellness. I do encourage you to, for more specific strategies, to develop resiliency, to learn how to regulate yourself, to go back to the January program and look at that. And in that program, I talked about 2 R's for self-regulation. Well, for stress, 2 R's for stress. It was to reach out and connect to other people, because that gets a good neurochemistry going. And I talked about to reach out to regulate, to get your bodies and your brains calm and back to kind of in the present moment place. But when the 2 R's are applied to mental health overall, sometimes keep in mind, reach out means asking for help from a parent, a loved one, someone you trust, or going to professional assessment, or going for a professional consultation, and possibly doing some treatment regarding your mental health. And regulate also means not just getting your brain and body back to a calm state that is present focused. It can be regulate by going to obtain these mental health services. You know, it's okay to seek out help. So thank you. I don't know if you have questions, but I do appreciate your being here.
Thank you, Dr. Marron. That was great. Some of the statistics are a little bit frightening, but hopefully, you know, we break this stigma and we start having meaningful conversations about the challenges that we face every day. Thank you so much. I, really appreciate it. And thank you everybody for tuning in. Does anybody have any questions or they would like to address? Now would be a good time. Of course, we will also share Dr. Marron's email address if you'd like to contact her privately. Excellent information. Thank you. Dr. Marron is very happy to hear that. And again, we will send a recording link as well as any useful handouts that Dr. Marron is going to share with us after the program. Thank you all again for tuning in, and thank you for your time again. And we will be back hopefully soon with a new topic for the spring. So just tune in, folks. And if you're interested, on our team website, we have our previous posts and recordings that Dr. Marron had mentioned during her presentation. So thank you. Have a good night.
Good night. Thanks, everybody.
Okay.